Matt, we explored on the programme last night the deep problems facing the NHS in England, Northern Ireland the night before. Today the figures in Wales simply reinforce just how bleak a picture it is here too, as ambulance workers, as you mentioned, go on strike again. The ambulance service in Wales last month received a record number of immediately life-threatening calls, but as you'll see, the proportion of those red calls responded to within 8 minutes has fallen from 48% in November to just 39.5% last month. That's a record low. The target there is 65%. And then in emergency departments in Wales, there's been yet another fall in the number of patients being admitted or transferred or discharged within 4 hours. That's down to now just 63%. Again, the worst performance on record. The target there is 95%. And in December, more than 12,000 patients waited in A&E for 12 hours or more. That's up 20% on the previous month, also the worst on record. Now, the Welsh Liberal Democrats today described the situation as a horror show. There are some improvements. The number of patients waiting for treatment continues to fall gradually, but frankly from huge levels. And one number stands out today: 586,000. That's the estimated number of patients on treatment waiting lists in Wales. As we've heard before, that's almost a fifth of the entire population. And it's these waiting lists, with some people waiting 2 years, 3 years, 4 years, even 5 years for treatment, which continues to cause so much concern. Day to day, how much pain is this causing you?
The pain is awful. It makes sleeping very difficult, maybe because every time you move, it hurts.
Rhiannon Rowley, who's 68, has been told she needs a hip replacement operation, but she hasn't even seen a consultant yet, despite being referred to one over a year ago.
This is where we make mattresses. We make organic mattresses.
But her ability to drive this business in Carmarthenshire isn't what it was. The pain of the osteoarthritis ever present. When you're sitting, when you're standing, when you're like this, does it make any difference?
No, there's nothing that makes it feel okay. Basically, it just feels as though your life is collapsing inwards all the time because there are layers and layers and layers of things that you just can't do anymore.
Wales. Yeah. Other patients facing similar have told her she could wait years for surgery.
A few years away, and I won't be in a position to do anything for myself. I think I'm probably within a few months of not being able to drive, a few months of not being able to get up the stairs at home, a few months within being in a really life-changing situation, and I'm not prepared to let that happen.
10 miles away at the Prince Philip Hospital in Llanelli, Shiona Gridley has just come out of surgery. A hand operation which took just 15 minutes, but for which she'd been waiting
23 months. It's been a long time.
How difficult has it been waiting for the treatment?
It's been very difficult because some days I can't use my hands at all. And I'm supposed to be my husband's carer, and he's been trying to care for me, so it's been a little bit of a mix-up.
In a neighbouring corridor, we're shown around the Hywel Dda University Health Board's brand new £20 million day surgery unit.
So at the moment we've got an arthroscopic camera stack there, which is a system we use for keyhole surgery. So this is utilities coming down from the roof to give you air supply, etc.
Welsh Government funded and now part of their drive to cut treatment waiting lists, which have been falling in recent months but remain staggeringly high. Today's figures show there are still 168,000 waits of over a year and almost 50,000 waits of 2 years or more. Owain Ennis speaks regularly to colleagues around Wales in his specialty, one of the worst affected, trauma and orthopaedics.
It's horrendous. I mean, from my perspective, I know that there are patients on my list that have been waiting from 2019. And the numbers of patients waiting are eye-watering. And the desperate situation they find themselves is also is also really concerning, because the impact on their quality of life and their general health and their mental health is incredible. I've got consultant colleagues who've had patients on the phone to them threatening to kill themselves if they don't get admitted. Now that burden on a clinician at that point, who is essentially seeing that patient or having that conversation with that patient in isolation at that point, is incredibly difficult. Well, I mean, what do you do in that situation?
Candidly, how would you characterise the current provision of orthopaedic services across Wales?
I would say it's a state of catastrophe, I'll be perfectly honest, in terms of our elective capacity.
Last year, Owain Ennis and other orthopaedic surgeons in Wales wrote a series of reports for the Welsh Government. Little publicised, but utterly damning. Their services, they said, were in a perilous state of near collapse, with episodes of patient harm frequent and ongoing. They cited a lack of surgery, lack of staff in places, lack of overarching leadership, and a history of warnings insufficiently heeded. They've called on the Welsh Government to establish 3 regional orthopaedic hubs at pace, part of a plan to protect more surgical beds from being diverted for unplanned care.
We recognise that it is likely to be a very, very expensive plan. However, the question is how can we afford not to do it when we see the impact it's having on patients?
The Welsh Government says it's committing significant extra long-term funding to tackle the backlog. But Rhiannon Rowley has given up on the NHS. Tomorrow she flies to Lithuania using savings to pay for a hip operation there.
I've worked all my life, looked after ageing parents, brought up 2 kids by myself, haven't been a burden on the state at all. And so, you know, to get to this age and to need something from the state and not be able to have it is really frustrating.
The charity Versus Arthritis, supporting people like Rhiannon, has described the situation as shocking and unacceptable. Well, earlier this afternoon, I spoke to the Welsh Health Minister, Eluned Morgan, who, like Labour colleagues here in the past, has claimed that more funding must come from the Conservative government in Westminster in order for the NHS in Wales to help address these issues. I asked her, did she fully grasp the level of desperation out there with people waiting years for treatment, often in agony, their physical health declining, their mental health declining, with some, as we've heard, even threatening to harm themselves in order to try to get access to treatment. I put it to her that it was an appalling state of affairs.
We've got to do better, without question, and we are actually seeing those waiting lists come down. Not fast enough, but they are coming down. Today we've seen our waiting list come down for the 2nd month in a row. We've got for the 8th month in a row, we've seen our longest waiters coming down. So we're heading in the right direction, but you're quite right, we've got much further to go.
There have been improvements we've seen today, and clearly those working in the NHS are working under intense pressure right now. But isn't the long-term picture here of one of patients in Wales consistently, on average, having to wait longer for planned treatment than in England? And how much longer do people in Wales have to tolerate this?
We've got a target where we're hoping to see those 2-year waiting lists come down to very low levels.
Which they've already done in England, effectively.
Well, we've already cleared about 29 different specialisms. We are challenged when it comes to orthopaedics and about 5 other areas. Obviously, COVID and flu, all of this doesn't help the situation. When you've got 7% of the workforce off sick,
but isn't that at the heart?
That is a problem.
Sorry to interrupt. Isn't that at the heart of the issue here? That every time there's an increase in demand for unplanned care, it's the elective surgery waiting lists that take the hit every time, and that's precisely why the Royal College of Surgeons is backing this call for you to set up 3 regional orthopaedic hubs at pace.
So we are in discussions with them on that. We're looking to see if that can be possible, and we've been working with them for a long time to see if we can get that in place. But I still think that we've got to look for the people who are on the waiting list at the moment, who are suffering in pain, who won't be able to wait for those hubs to get developed. And that's why what we're doing, for example, is to develop new facilities where we can get people through on a quicker pace than we've seen in the past. So lots of investment going in. We need to maximise the efficiency of the model we have at the moment. And we need surgeons in Wales to be benchmarking themselves against the productivity levels across the rest of the UK as well.
So it's their fault?
No. I mean, I'll take some responsibility here, of course.
How big a problem has mismanagement of the NHS been in Wales? Because your orthopaedic surgeons think that leadership at the Welsh Government level, at Health Board level, over the last 20 years has been found wanting, and crucial opportunities to get this right have been missed.
Look, I can take responsibility for the past 18 months or so since I've been in post. And
but it's the Welsh Labour government that's been in power uninterrupted for more than 20 years.
Absolutely, and we understand that, and if you look at what was happening pre-pandemic, actually we were down to about 9,000 people just before the pandemic waiting for 36 months. So we were getting there, and then of course the pandemic has knocked us out very considerably.
It's not just orthopaedic surgeons here who are despairing at the situation. One consultant cardiologist in a Welsh Health Board has told me that it's taken 12 years to develop into this storm. It's chaos. We are providing a substandard level of care. It's dangerous and inhumane.
Well, I think that we should look at what the NHS in Wales is already delivering. We have 2 million contacts a month in Wales. That's in a population of 3.1 million. So the system is working for the vast majority of the people. They are getting a good service. I recognise that there are people who are frustrated, who are angry and who are living in pain, and of course that's something that we're very focused on.